So, as a healthcare provider, you have a unique struggle, you and your staff. The challenge to navigate your EMR, obviously, and meet those requirements by the government, while trying to implement solutions and multiple solutions to supplement your EMR. So, you may have a fax solution or a multi purpose fax machine in your office. You are probably either doing manual phone calls to remind patients of appointments, or possibly you already have an automated system that you're using. And then you may have a texting feature to text with possibly other colleagues or your patients. All of these different solutions rolled up into kind of a mess, jumping back and forth between each one, going back to your EMR, and then probably not all of the solutions you're using interface with your EMR. So a lot of work to work with solutions that are supposed to be making your life easier. What Updox provides is all of these solutions rolled up into one centralized location. So today's presentation, I'll be walking you through how leveraging Updox with your EMR will allow your practice to eliminate the unnecessary solutions, so all of your multiple point solutions, and drop down to just one platform to do all of those very, very important things in your practice. So if you are not familiar, Updox was started about 8 years ago by a physician who was really frustrated by the lack of technology developed for the healthcare industry. So after spending his time on manual process and paper for years, he partnered with our co-founders to design Updox, the leading communication platform for healthcare. One of our most successful solutions was really the start in our bread and butter, which was the communication platform, leveraging electronic fax. But since then, we obviously have spread across the country with a robust suite of solutions. Now we have over 300,000 users on Updox, covering over 72 million patients, with integrations with over 100 EMRs. So this provides a level of interoperability for a multitude of solutions that these single point solutions just can't do for you. Just a quick note, obviously you can take my word for it or the word of all of the people probably contacting you from Updox, or you can take the word of one of our longtime users. So the quote really says it all. Updox allows healthcare practices to leverage a single platform that helps boost patient engagement, productivity, and enables better communication, which really allows your practice to work as efficiently and effectively as possible. Not only communicating with patients, but also with your colleagues and even your staff. So what we'll talk about today is the 3 different platforms that Updox allows and provides for practices, and how those platforms can individually help you achieve some of these benefits. So what exactly does Updox provide for you? We provide a platform for smooth communication, also HIPAA compliant communication. We help you boost the overall productivity of your staff and your practice. And then we also help you boost that engagement, whether that engagement is with your patients or not. As obviously you have heard, the trend is patients are acting more as consumers. So you obviously want to keep them engaged, and having people come into your practice and improve their outcomes is obviously the point of the game. But you want to have engagement as well with your colleagues. So keeping your referral network full and keeping that calendar full is obviously a big thing for your practice as well. So I'm just going to step into each of these platforms and kind of roll out to show you exactly what is involved with each one of those and how we can help your workflow. So the first one's going to be our communication platform. That includes the inbound and outbound electronic faxing, all HIPAA compliant and remote accessible, so anywhere with an internet connection you can access your faxes. We provide direct messaging and then behind the scenes direct secure email. So if you got a direct secure email for meaningful use, you are probably already a part of our directory. Updox is the second largest HISP in the nation. So we have, I think it's over 1.4 million healthcare providers already in our directory. So if you were to sign up for the communication platform, you would get access to that directory immediately. And then coming very, very soon, we will have something called Team Messenger, which is something I will walk through later in the presentation. So first and foremost, with our communication platform, you're able to fax. Here is just a quick picture of the inbox, and Tanya Jones is going to be our pseudo front desk manager right now. But when you come into the inbox, everything will be color coded. So that means all of your communication, whether that be a fax, a secure email, something you've uploaded from the EMR, or even a text message, all of those things are located in one central place. So Tanya comes in at the beginning of the day, comes in and looks into her inbox to see what's come in. You can organize that by priority. You can organize it by the document type. So she comes in and sees she has a fax. Now, most fax solutions, if you are using an electronic solution, you have to really kind of click into each document, see if it's the document you're looking for, also move past the cover page if there is one. With Updox, you're able to just simply hover over these documents so that you know if you need to send something to the patient's chart, but you don't need to include the cover page, obviously. You can section those things off and manage your documents all here in the inbox without having to click into anything. With that, we also have the editor. So Updox provides a full, robust editor that allows you to do different things. So a lot of the documents that you're sending out obviously will require some sort of annotation or changes. So from here, you can click the Add Text button. You can add in a note if you'd like. You can highlight to make sure that whomever you're sending these things to see only what they need to see. And we also have different checkboxes and things. We have the redact option. You can scribble all over it if you'd like to. Any way to avoid the post-it notes or the little paper notes you're leaving all around the office, we can definitely help you with that. We also have a one-click signature. So if you are a part of the office staff that's constantly having to track down the provider or task the provider in the EHR trying to get signed off on different things, or requesting a sign off on a document over email, probably not the best way because it's not really HIPAA compliant. What we can provide you is a way to allow the doctor to see only what they need to see and then sign off with one click and then send back directly. So that's just a little taste of the communication platform. The next piece we're going to discuss is the productivity platform. So this provides you the document management, which you saw a little bit of right there, task management, and then obviously coming soon, the team messenger, which we'll dive into shortly. With the productivity platform, the document management is really the key portion of this. So with Updox, you're able to kind of coordinate and customize your workflow based on how you operate at your practice. If you are only a single provider practice, you don't really need to chase down the provider too much. You can definitely fit these workflows to your needs. Or if you have a ton of providers, Updox was built in a way that allows every practice to build out the workflow that's custom to their work. So here we have tags. So tags is a great feature for you to be able to either mark things by priority, mark things by department. If you only want the front desk staff to see certain items, you can tag them a certain way. If you need the provider to sign off on something, you can tag it urgent. We have 39 customizable tags dependent on how you would like to set them up. And from there, you're able to tag documents so that when people are signing into Updox, they only need to see what's necessary to them. Another easy way to do this is with queues. So if you are a part of a bigger practice, you have a lot of different doctors and then all of the doctors have their own staff, you can set different queues up so that files are automatically going and routing into these queues. Or if you want a front desk person to kind of triage these as necessary and assign them to queues, you can do that as well. But queues and tags are both great ways to customize the workflow as your documents are coming in. So from there, we have the bulk platform of our communication platform, and that's our engagement side. So with that, we offer up the automated appointment reminders. We offer broadcast messaging, which is tailored messaging on the fly. We are now offering HIPAA compliant text, so that is a secure way covering HIPAA standards to text message your patients. We provide online scheduling and patient payments as well. So just to walk you through a simple workflow that I'm sure a lot of you are familiar with, you have a patient schedule an appointment. That's great news. Obviously, you want them to show up for the appointment. So, what automatic appointment reminders do, I think the stat is that they cut down 30% on your no show rate and can sometimes even eliminate no shows. No shows are extremely costly for a practice, especially if you are a smaller practice. Having those patients show up is your number one priority. So, what Updox provides is an automated appointment reminder system that allows you to set it up one time based on your patient preferences, and then it just runs around in the background. So your staff might not even know you've implemented a change necessarily because it should be seamless and built into your current workflow. Once you set these up in our free training with our support team, it should just run automatically. And then from here, you see the patient receives a customized message on her cell phone. So we offer 3 separate methods of delivery for our reminder solution. We offer a phone call, an email, or an SMS text message. So just based on your patient preferences and your practice preferences. From there, we also provide the broadcast solution. So broadcast messaging is a way to kind of keep in touch and keep at the forefront of your patient's thoughts without reminding them for an appointment. So what you can do is tailor this messaging based on your list. So you can build a custom patient list, whether that be by demographic, sex, age, whatever. You can build a list and then send out a customized message dependent on what you want to convey. So here we have Dr. Waters sending out a message about diabetes screening. This is also a great way to generate more revenue. As you have new services offered, you can send out different segmented lists to patients to let them know to come in to take part in these services. And then here we have our SMS text quick send, or what we call now our secure text messaging. So you can send out a text either HIPAA compliantly or just send general information to someone. This example is Dr. Waters sending out a screening what to expect educational information to one of her patients who have signed up for one of the diabetes screenings. From there, the patient is able to become a little bit more educated on what to expect before that appointment, providing them a more meaningful appointment. All of this is going to be remote accessible, so either for the doctor or for the patient. So if you wanted to send out a quick send text message when you're at home for the day, if the office is closed down and you want to let all of your patients know that it's closed down, no worries, you can definitely do that from the safety of your own home, keeping it HIPAA compliant. So once the patient receives that information, as I said before, it's going to really just improve the experience overall for your patients. So once they enter the examination room, you've already reminded them of their appointment, so they should be there. You've educated them on any of the new services you might be offering. And then you've also educated them to a level that you may not have been able to before just by phone. So you're providing them, you're arming them really with the information that they need to get the most out of their healthcare as well. Now from here, the workflow story we're trying to tell is that possibly that patient coming in for the diabetes screening may have had some higher blood levels or something amiss in the appointment. And from here, the front desk office manager, Tanya, messages Dr. Waters in our team messenger. So just like I said before, this is going to be rolling out very, very soon, but this is going to be an extension of the Updox inbox where your internal team is able to message each other directly and then also file those conversations to the patient's chart. So from here, they have a little side discussion on what exactly to do with the results they got back for their patient. They realize they might need a second opinion. So from there, they're able to jump back into the inbox and use the communication tool to confer with one of their colleagues, Dr. Vandelay, an endocrinologist in the area. They can say, hey, we got these results back, not sure what your feelings are, but we want to make sure we get all of them squared away before they send them back to the patient. After replying, your team can then internally figure out what exactly the next step will be. Here, they want to let Jane know that she's all good to go and that her results were fine. So from there, that's where the secure text feature will come in. With secure text, HIPAA compliance requires a two-step verification process to make it 100% HIPAA compliant. So from here, we're able to send directly to the patient's phone. That's your first step. And then they have to verify their birth date, the second step. From here, you're able to share results with your patients. You're able to share images if they'd like on some of their results, or maybe some x-rays. Either way, you're able to send messages directly where your patients are. I think it's 91% of adults in America have their cell phone with them at some point, all times of the day. So if you're like me, I have my phone just a few feet away from me, and I'm sure you guys have your phones close by too. From here, you can see that your patients want to be engaged in a way that's easy for them, that's convenient for them. With all of these apps coming out and all of these crazy ways we can communicate with each other, one thing still holds true is that they're going to have their phone near them. So if you're able to communicate with them and share results with them in a way that they prefer, that's going to make the most impact. So from here in our story, Dr. Waters shares that her results were fine. Hopefully they see her again at another visit very soon, where Jane can then respond. And you can also file these text threads directly to the patient's chart as well, making it seamless for you. One simple inbox with all of these tools necessary for providing the best patient experience and possibly really result in those improved outcomes that we're working for. So just a quick note from one of our users, Dr. Boucher. He's really been a champion for the patient engagement side of things. He has a lot of great use cases that you can find on our website where he really educates his patient database before any of their appointments, making the most valuable patient interactions that he can get. But from here, just to wrap it up a little bit, Updox provides 3 separate suites, so the communication, the engagement, and the productivity, but all of these suites combined together into one single inbox help do a multitude of things. So they help you streamline the manual process or eliminate the manual process. Empower your patients to become advocates in their care. So really educating them and arming them with the information that they need so that they are true team players in their care. We help you generate new revenue, whether that be educating on new services coming up or generally keeping in contact with those referral sources to make sure that your calendar is staying full. We also help you drive provider relationships. We help you communicate with other providers in a way that is easy to their workflow and really easy to your workflow. So if you need to do that timely follow-up, or you want to just let them know that you are opening a second location, you can do all of that within the same workflow that you're working from within Updox.